Let's get a medical perspective now from Harjit Singh Bhatti. He's a doctor of internal medicine and national president of the Progressive Medicos and Scientists Forum. He's also in the capital, New Delhi. Really appreciate your time, Dr. Bhatti. Now, as we heard there from Ishan, India does have a very high recovery rate. But you've been quite critical of these figures. On social media platform Twitter, you've written, and I quote, "Don't fall prey to low mortality." What are your reasons for saying that?
Because first of all, India's healthcare system is not that systematic and it is not uniform that we will get the complete information from that healthcare system. Second thing is that we know that India's even the death registration system, the death registration system is also not up to the mark, and there might be a possibility that many of the patients who are died of infection may not get registered into the death registry, or it might be possible that they have neither have access to healthcare system, and it might be possible that they have not have access to testing, RT-PCR testing, because I want to tell that RT-PCR is still a privilege and it is not easily available to all the people, especially those who are residing in rural areas. So seeing these parameters, we can say that death rate is low at present time, but because of poor healthcare system and because of incomplete death registry system, the number may be higher also.
So, Doctor, do you feel Narendra Modi's government is doing enough to combat the spread of COVID-19?
Actually, they are trying to combat the situation, but the situation initially they underestimated the situation. Now they are understanding that this virus has a large infection rate, and if the infection will continue to rise as it is going on now, then it can result into lots of population being infected, and in that population, even smaller percentage can result into a large number of casualties. So that's why now they are trying to ramp up testing. They are trying to accommodate patients to certain areas, but still the efforts was not up to the mark, and we are still seeing that the government is trying more to validate or trying to more say that they are successful in imposing lockdown, or saying that there is no community transmission. So they are trying more to protect themselves rather than being the people, so which is the main worrisome thing for me as a physician.
So with all of that being said, what measures do you want to see them put in place to protect both Indian citizens as well as healthcare workers?
First thing is that we need more healthcare workers into the system, because even if you increase beds or do whatever you want, but if there is no manpower, then it will be very difficult. But till now, there is not much recruitment drives we have seen. We have also not seen any efforts to increase hospital beds, and only public healthcare system, which is already a limited uh, have a very limited infrastructure, only that is involved to take care of the patients. But the private sector, which is the major infrastructure and manpower sector in healthcare in India, which is almost 65 to 70% of India's healthcare, that was not, even till now, it was not appropriately involved. So I think if the government take control of the infrastructure and manpower of private sector and bear their cost, and then you utilize the whole healthcare infrastructure for people's care and for taking care of COVID, then only we can expect some remedies to this COVID virus. Otherwise, this infection will goes on increasing, and we can see it goes on means more deaths in the coming time.
Hopefully that will be something that the government does take on board. Dr. Harjit Singh Bhatti, live to us from Nigeria. Really appreciate your take on that.